So personality definitely comes into it. So occupation and personality, and that's really touched on during our consults. We have a quite thorough consult. We need to work out what people's visual requirements are, what their expectations are from the surgery. Obviously, everyone wants perfection, but perfection is not always possible. So I think we strive for that, but patients need to have a really clear understanding of the potential risks of surgery. It's obviously really safe overall, but there are still risks to eye surgery. They need to have an understanding of what kind of vision they're going to get out of the surgery. And we discuss all of this really in depth at the consultation. But for sure, different personalities might mean that, you choose one procedure over another, but we really tailor that depending on what we've kind of brought up at the conversation.
So people in certain occupations, like pilots, for example, they might have like very high expectations.
So they might have they need to have high expectations because their license depends on it. So, they'll have very clear requirements for good distance vision. They'll need to maintain contrast sensitivity. So, yeah, we definitely take that into account. Generally, laser, as a general of thumb, upholds most of these requirements. It's actually a very precise type of surgery. And as does our premium cataract surgery and our clear lens extraction. But, you have to go through all the risks. So some of the multifocal lenses might have a side effect of visual aura, like glare and halos around lights, and that needs to be shown to a patient through a simulator and discussed with patients. So I think we have to tailor all the procedures based on occupation, personality, medical history, and clinical exam. So all these things together help us decide, should they have surgery? Are they a good candidate? And what surgery should they have? Because, as I've said, we've got a whole host of options for our patients, which are not only age dependent, but they're also dependent on the suitability of what they do.
Yeah. You mentioned with multifocal lenses, there can be sometimes issues with light. You're talking about refractive lens exchange here?
Yeah, so refractive lens exchange or clear lens extraction, we're essentially removing the natural lens in the eye and replacing it with an artificial lens. And whilst those lenses are amazing and the technology continues to improve, it's important for patients to, again, have clear expectations about what they're getting from the surgery and what that lens is going to deliver for their eyes and for their occupation.
And what about LASIK? With LASIK and PRESBYOND and SMILE, are there any issues like that with light?
So generally, contrast sensitivity is extremely good with laser. That's not usually an issue. Sometimes you can get some glare and halos around lights at nighttime. Usually that goes away with time or gets better with time. We don't really have that many patients that really report that. We're very careful here because, again, we customize for patients. So I'm very careful looking at measuring pupil size of the patients in the dark and then customizing the optical zone of my laser to compensate for that. So patients then, the treatment is essentially suitable for their pupil size. So generally we don't have many complaints about glare and halos at night time. And usually there's a neuroadaptation period anyway. So with time that gets better on its own.